If we look at the veins and venous drainage of the lower limb, it is of great importance. This is because in the lower limb, venous blood must ascend against gravity. The blood that has already circulated through the body's tissues and organs and is returning to the heart has to ascend against gravity in some parts of the body, such as in the legs. This is because the veins must work against the force of gravity to transport blood back to the heart. This is aided by several general and local factors, the failure of which gives rise to varicose veins. General factors: negative intrathoracic pressure, which is made more negative during inspiration; arterial pressure and overflow from the capillary bed; compression of veins accompanying arteries by arterial pulsation; the presence of valves supports and divides the long column of blood into shorter columns. These also maintain a unidirectional flow. While the local factors are related to the venous, muscular, and fascial. First, we have the venous factor. The veins of the lower limb are more muscular than the veins of any other part of the body. They have greater number of valves. Superficial veins are connected to deep veins by perforators. Secondly, the muscular factors. When the lime is active, muscular contraction compresses the deep veins and drives the blood in them upwards. As for the fascial factor, the tight sleeve of the deep fascia makes muscular compression of the veins much more effective by limiting outward bulging of the muscles. Now let's look at the veins of the lower limb. We have already talked about some of these veins in previous lectures. The veins may be classified into three groups: superficial veins, deep veins, and a third group I will talk about later. The superficial veins are found in the subcutaneous tissue. They eventually drain into the deep veins. They include the great and small saphenous veins and their tributaries. They are thick-walled because of the presence of smooth muscle and some fibrous and elastic tissues in their walls. Valves are more numerous in the distal parts of these veins than in their proximal parts. A large proportion of their blood is drained into the deep veins through the perforating veins. The deep veins are located underneath the deep fascia of the lower limb, accompanying the major arteries. They accompany the arteries and are supported by powerful surrounding muscles. The valves are more numerous in deep veins than in superficial veins. These are the medial plantar, lateral plantar, dorsalis pedis, anterior and posterior tibial, peroneal, popliteal, and femoral veins and their tributaries. They are more efficient channels than superficial veins because of the driving force of muscular contraction. Other than the superficial and deep veins, there is a third type known as perforating veins. They connect the superficial with the deep veins. Their valves permit only one-way flow of blood from the superficial to the deep veins. There are about 5 perforators along the great saphenous vein, and 1 perforator along the small saphenous vein. Let's look at the deep veins of the lower limb a bit more closely. As mentioned earlier, the deep venous drainage system is located beneath the deep fascia of the lower limb. Here you can see the veins only without any layers of muscles and fascia. As a general rule, the deep veins accompany and share the name of the major arteries in the lower limb. Often, the artery and vein are located within the same vascular sheath, so that the arterial pulsations aid the venous return. The foot and leg. The main venous structure of the foot is the dorsal venous arch, the dorsum of foot, and the plantar venous arch, at the plantar surface of foot. These arches mostly drain into the superficial veins. Some veins from the arch penetrate deep into the leg, forming the anterior tibial vein. On the plantar aspect of the foot, medial and lateral plantar veins arise. These veins combine to form the posterior tibial and fibular veins. The posterior tibial vein accompanies the posterior tibial artery, entering the leg posteriorly to the medial malleolus. On the posterior surface of the knee, the anterior tibial, posterior tibial and fibular veins unite to form the popliteal vein. The popliteal vein enters the thigh via the adductor canal. These are the deep veins found in the regions of foot and leg. Now, let's look at the veins in the region of the thigh. I mentioned earlier that the popliteal vein enters the thigh. As it ascends, it is now known as the femoral vein. It is situated anteriorly, accompanying the femoral artery. The deep vein of the thigh, profunda femoris vein, is the other main venous structure in the thigh. These veins give many tributaries, as shown here, that accompany the arteries of the region. The femoral vein leaves the thigh by running underneath the inguinal ligament, at which point it is known as the external iliac vein. If we ascend any further, we will enter the gluteal region. The deep veins found in the gluteal region are branches of the external iliac vein. These are the bisuperior and inferior gluteal veins. These empty into the internal iliac vein. So, we are done with the deep veins of the lower limb. Let's look at the superficial veins now. The superficial veins of the lower limb run in the subcutaneous tissue. There are two major superficial veins, the great saphenous vein and the small saphenous vein. The great saphenous vein. The great saphenous vein is formed by the dorsal venous arch of the foot and the dorsal vein of the great toe. The vein is also connected to the deep veins of the limb by perforating veins. It ascends the medial side of the leg, passing anteriorly to the medial malleolus at the ankle, and posteriorly to the medial condyle at the knee. In the thigh, it inclines forwards to reach the saphenous opening, where it pierces the cribriform fascia and opens into the femoral vein. Before piercing the cribriform fascia, it receives three named tributaries corresponding to the three cutaneous arteries and many unnamed tributaries. The great saphenous vein terminates by draining into the femoral vein, a deep vein of the region immediately inferior to the inguinal ligament. Coronary artery bypass surgery is a procedure used to treat blockages in the coronary arteries, which supply blood to the heart muscle. During this surgery, a healthy blood vessel from another part of the body is used to create a bypass around the blocked portion of the coronary artery. The great saphenous vein is one such blood vessel that can be harvested and used in coronary artery bypass surgery. It is the longest vein in the body, running from the foot to the groin, and is commonly used as a graft in this procedure. During the bypass surgery, the great saphenous vein is connected to the coronary artery, creating a new pathway for blood to flow around the blockage. That is all about the great saphenous vein. Let's look at the small saphenous vein now. The small saphenous vein is formed by the dorsal venous arch of the foot and the dorsal vein of the little toe. As you can see here, it moves up the posterior side of the leg, passing posteriorly to the lateral malleolus, along the lateral border of the calcaneal tendon. It ascends between the two heads of the gastrocnemius muscle and empties into the popliteal vein in the popliteal fossa. It drains the lateral border of the foot, the heel, and the back of the leg. It relates to the great saphenous and with the deep veins, and is accompanied by the sural nerve. We are just about done with our discussion on the veins of lower limb. Lastly, let's look at the perforating veins. As already mentioned, they connect the superficial with the deep veins. Here is the deep vein under the layers of muscle and fascia. And here lies a superficial vein. The perforating veins act as bridge between these veins. The perforating veins are also provided with valves which permit flow of blood only from the superficial to the deep veins. Failure of the valves also gives rise to varicose veins. These veins are classified as follows: indirect perforating veins and direct perforating veins. Indirect perforating veins connect the superficial veins with the deep veins through the muscular veins. Direct perforating veins connect the superficial veins directly with the deep veins. The great and small saphenous veins are the large direct perforators. The small direct perforating veins are follows. In the thigh, the adductor canal perforator connects the great saphenous vein with the femoral vein in the lower part of the adductor canal. Below the knee, one perforator connects the small saphenous vein or the posterior arch vein with the posterior tibial vein. In the leg, a lateral perforator is present at the junction of the middle and lower thirds of the leg. It connects the small saphenous vein or one of its tributaries with the peroneal vein. Medially, there are 3 perforators which connect the posterior arch vein with the posterior tibial vein. The upper medial perforator lies at junction of the middle and lower thirds of the leg. The middle medial perforator lies above the medial malleolus. The lower medial perforator lies posterior-inferior to the medial malleolus. As we have seen, the veins of the lower limb are classified into 3 groups. They play a critical role in returning blood from the legs and feet back to the heart. Proper blood flow through these veins is essential for maintaining overall health and preventing conditions such as deep vein thrombosis. If you wish to learn about the condition called deep vein thrombosis, check out our video on this topic here at sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.